SilvaSorb is a polyacrylate sheet that combines controlled-release antimicrobial silver with advanced fluid management. SilvaSorb can absorb more than 5 times its weight in exudate while helping provide a barrier against infection for up to 7 days. SilvaSorb is available in 4 formats. SilvaSorb sheets for flat wounds with no to moderate exudate. SilvaSorb perforated sheets for flat wounds with moderate to heavy exudate. SilvaSorb cavity for wounds with depth and all exudate levels, or for shallow wounds with moderate to heavy drainage. SilvaSorb hydrogel for dry wounds, and SilvaSorb site, which is designed to wrap around vascular and non-vascular percutaneous devices, such as IV catheters, PICC sites, central venous lines, arterial catheters, and orthopedic devices like external fixator pins. The dressing is a 1-inch disc with a 4 mm saddle opening and a radial slit. SilvaSorb is indicated for stage 1 to 4 pressure ulcers, partial and full thickness wounds, leg ulcers, diabetic foot ulcers, grafted wounds and donor sites, skin tears, surgical wounds, lacerations and abrasions, and 1st and 2nd degree burns. SilvaSorb is contraindicated for those individuals with known sensitivity to silver. SilvaSorb sheets. To apply SilvaSorb perforated or non-perforated sheets, cleanse the wound area with Skintegrity Wound Cleanser. Then select the appropriate size sheet, allowing for at least 1/2 inch overlap of all peri-wound skin. Open the package and remove the carrier paper from the sheet. Place the sheet over the wound and secure in place with a secondary dressing, such as bordered gauze. SilvaSorb sheets can be left on for up to 7 days, depending upon the amount of exudate. To apply SilvaSorb gel, cleanse the wound area with Skintegrity Wound Cleanser. Then squirt an appropriate amount of SilvaSorb gel onto your finger or tongue blade and apply it to the wound. Cover with bordered gauze or other secondary dressing. SilvaSorb gel may be left on the wound for up to 3 days. To apply SilvaSorb cavity, fill the wound cavity to approximately 2/3 full. SilvaSorb cavity strands will swell as they absorb. If desired, tear the dressing at the matrix bridge and only use the needed amount. Cover with an appropriate secondary dressing such as bordered gauze or simply a gauze pad secured with Medfix tape. For all SilvaSorb dressings, the dressing should be changed when the exudate begins to pool within the wound or if there is significant strike-through onto the secondary dressing. Initially, dressing changes may be more frequent until the bacteria burden is reduced. To apply SilvaSorb site, open the package and remove the dressing from the carrier sheet. Slide the dressing around the penetration site, placing either side of the dressing against the skin. The 2 sides of the radial slit can be brought back together, slightly overlapped, and should align beneath the device hub, such as an IV catheter. The slit edges must approximate each other to maximize efficacy. Secure the catheter and the SilvaSorb site dressing with a transparent film, such as SureSight window. SilvaSorb site can be left on for up to 7 days. Please note that SilvaSorb dressing material is photosensitive and will darken as it is exposed to light. This will not affect the performance of the dressing.